This is Dr. Kevin Ashbran at Newport Harbor Animal Hospital. I'm here today to talk a little bit more about endoscopic procedures in your dog. We have another video that discusses some just basic questions about endoscopy in your pet dog. Today we're going to answer some more questions that we've written down that we often get from clients about what will happen during an endoscopy procedure. So my assistant Brittany will help us and ask some questions, and I'll try to answer them for you.
Dr. Ashbran, how can I help my dog prepare for an endoscopy?
Again, I think if you saw our other video, we talked a little bit about it there. But if not, it's an anesthetic procedure that's going to require general anesthesia. So we're going to want them fasted. They can eat dinner the night before, and then after about 9 o'clock the night before, we're going to stop feeding them. They can have water through the night, pull water in the morning. They're going to get here at the hospital early in the morning. They're going to get checked in by our team, and our surgical technician, who happens to be Brittany, will go through the procedure and what to expect for that day. So it's basically just fasting overnight to get through the upper GI tract, so the esophagus, the stomach, and the intestinal tract. If we are doing a colonoscopy, it can be a little more involved, and you would get detailed instructions from your veterinarian. But just for the endoscopy procedure, just to be fasted, we need the food out of the way, basically, is what I'm trying to get at. No food in the stomach or the small intestine, so we can see things better.
Will my dog receive pain medications before an endoscopy?
Yes. Part of our anesthetic protocol here at Newport Harbor does involve a small pre-anesthetic medication that happens to be a pain medication. Endoscopic procedures and endoscopy procedures are not inherently painful. One of the reasons, again, we like them. They're less invasive than a surgical procedure, but it does help us achieve a good level of anesthesia, and it does prevent any kind of discomfort that scope may cause by irritating the lining of the esophagus and stomach. So yes, they will receive a pain medication.
What happens during a dog endoscopy?
Great question. Your dogs are put under full general anesthesia. So again, you get checked in during the day, and I'll sort of walk you through the day. The doctor will do a pre-anesthetic exam on your pet, make sure, again, nothing's changed and they're healthy again for anesthesia. An IV catheter will be placed so we can give medications, and so your pet can receive IV fluids. IV fluids will be started. Your pet will then be put under general anesthetic by the surgical team, the doctor, and the technician. Your pet will be monitored with the most high-tech monitoring equipment. We monitor blood pressure, EKG, oxygen saturation, CO2 saturation, blood pressure, just like a human would be monitored under anesthesia. And then they would be placed in a room like this, our surgical suite, with our endoscope placed on their side, and the doctor and the tech, the tech would monitor anesthesia, and the doctor passes the scope through your dog's mouth into the esophagus, which connects the mouth to the stomach. Make sure, and when you do that, you look for any abnormalities, and then into the stomach, look for any abnormalities, and then if again we can reach with the scope into that first part of the small intestine. When the procedure is done, if we needed to collect biopsies, we would put a forceps down, collect pinch biopsies of the intestinal or stomach wall, and submit those to the laboratory. If we're in there trying to do a foreign body retrieval, again, we would use those forceps to grab the foreign body and remove it. Afterward, we'd remove the camera and wake up your pet from anesthesia, and the technician would monitor your pet during the wake up.
Who gives my dog the anesthesia for an endoscopy?
The doctor does. Here at Newport Harbor Animal Hospital, again, we're a surgical team of two or more people. Sometimes endoscopies require somebody to work the forceps, so sometimes there's 3 people. But the person who gives the anesthetic is the doctor here. And the tech, again, we have one person monitoring at all times, one person working the camera at all times, and that's the doctor. The doctor does anesthetize your pet in the beginning, help them get ready. And then if we do need the forceps used, again, that would be the 3rd person of our team. But the doctor is the person on the team that does administer the anesthesia.
How will my dog be monitored during an endoscopy?
We talked about that a little bit. I'll just quickly go through that again. We obviously anesthesia is serious, and we take it very seriously here at Newport Harbor Animal Hospital. So again, our dedicated team, that's all they're going to do at that moment. So the doctor and the technician are going to monitor the anesthetic equipment, make sure the machine is set up right, and we have all the right doses of medications. But during the procedure, they will be monitored. Their blood pressure will be monitored. Their heart rate and rhythm will be monitored with an EKG. Their oxygen saturation will be monitored. Their respiratory rates will be monitored. CO2 levels will be monitored just like you would at a human hospital. And again, we dedicate a team just to that. And there's a person in the anesthetic suite and surgical suite just to do that and monitor your pet. So we're not, again, missing anything. We take anesthesia very seriously, and we want to make sure your pet is as safe as possible.
Are there any risks or side effects associated with the dog endoscopies?
The risks are minimal. That's one of the reasons we like them and prefer them. Obviously, they are, like we've talked about in other questions and other videos, they are much less invasive than a full exploratory surgery. But general anesthesia always has risks. And one of the reasons we do pre-anesthetic exams and pre-anesthetic blood work at a minimum is to make sure your pet is safe to go under anesthesia, and we minimize those risks. In certain pets with other diseases or certain pets of certain ages, we may also do other testing, x-rays or ultrasounds, to make sure they're safe to go under anesthesia. So anesthesia is the biggest concern with an endoscopy. And again, we do everything we can to minimize those risks here at Newport Harbor Animal Hospital. Some of the other complications, risks are going to be pretty minor. Again, some irritation may happen with the esophagus or stomach from passing the camera down the esophagus or stomach or intestines. If we take biopsy, some of those areas of intestinal wall may be a little irritated or sore or inflamed for a little bit of time, a few days to a week. So often we will send home some medications to mitigate that, some gastrointestinal protectants to help limit that. Other than that, the risks are pretty minimal. I just want to wrap up the video. Thanks for watching. Here at Newport Harbor Animal Hospital, we're a 8-doctor practice, general practice that does endoscopic procedures. If you have more questions or feel that your pet may need this procedure, please call to schedule an appointment with one of our doctors. Even if it's a doctor who doesn't do that procedure, we can obviously discuss it and get you scheduled with the right person if that's what's needed.